Hi, this is Nancy Strawn, and I'm with Dana Hargis, and we are working with Isaiah 61 Foundation out of Ada, Oklahoma. And it's good that you're here with us today. We're really happy that you would choose to take your time to spend with us. What we're doing today is what would be session 1 of our parent education. We do parent education here in-house, usually. But today we're doing it with you at home, and we have really enjoyed getting to know people through internet. So join us, and we'll enjoy our time with you. Dana, is there anything you want to say before we start?
Just that I'm excited to put this in this format because currently we can only serve the people who can get here at the time the classes are offered. So I'm very hopeful that this will be accessible to a much larger crowd, will allow people, even that do make it here, to review certain sessions if they miss them, or if they're not sure what, if they need more clarification. So I hope this reaches a much larger crowd.
Yes, and I think this will be a little different than possibly what you perceive. The first session, what I do, is we just talk about how you became the person that you've become as an adult and as a parent, how your childhood has an impact on your relationships now, and how it also affects the way that you parent, and how we can change things should it need to change. But this is the first session is really about perception and just getting some awareness of what the research says in regards to how we become who we become. So I'll also talk about the fact first that we use a program that was developed by Dr. Karen Purvis. She was a developmental psychologist, and she worked with Texas Christian University in Fort Worth, Texas, and we were very, Dana was the one that got to go down and become
An
instructor through her program. And how many people were allowed to take that program?
Well, the training that I went to, there were 150 people who participated with over 500 applications. And there were people from all over the world there. So I was very honored to be there, and the training was so helpful. And I learned so many things about how trauma impacts the brain. And the most important thing that I think I learned was that there's hope for everyone.
Yes, there is hope for everyone. Karen Purvis, who was the developer of this, she has since passed a few years ago. She is a personal hero of mine, and she did not go back to school. She dropped out of college her sophomore year, and she married her husband, who was a Baptist and is a Southern Baptist minister. And they did ministry together for many years. When one of her sons went back to college is when she chose to go back to college. And she was in her 40s. She went through, got her undergrad, got her master's, and got her PhD, and became a developmental psychologist, which works with children. But a lot of what she learned working with the underprivileged and in children's ministry. She had a real heart for children, and she also worked extensively with foster care and with adoptive parents, and also with orphanages in Eastern Europe, which is known for having very difficult situations. And people are still going over there from TCU in Fort Worth, students every summer, to work with those children in Eastern Europe, orphanages. She touched thousands and is continuing her legacy to touch thousands of lives. She had an amazing life and really didn't start to do this type of work at this level as a developmental psychologist until she was in her 50s. The Child Development Center at Texas Christian University is named after her, Karen Purvis Child Development Center. So it's great, the department there. And we are very, very glad that we are able to use her program. Now, her program is based on something called attachment theory, which has been around for over 50 years, and John Bowlby was a British developmental psychologist himself who worked with children. And it has been researched and researched through the years. It really deals with your attachment style. So there is secure attachment and there's insecure attachment. It all goes back to how you were raised by your primary caregiver in the early years of your life, particularly your infancy. But really, the first 5 years are very important. So as your mother came and you would cry, she would pick you up. And she would look to attune and understand what your needs were. So if you were hungry, she would feed you. If you needed your diaper changed, she would do that. She would talk to you, she would nurture you. And so you went from having, you were crying and in need, and you've got to remember stress hormones are going at that point for an infant, so cortisol is high. She would meet those needs, and you would calm down. And so at that point, you are starting to have all these neurons firing, and you're creating the neuron patterns in your brain. So as she met your needs, you calmed down, and your cortisol levels went down, you felt better, and you had connected because someone had met your needs, so you felt safe. Attachment, secure attachment, is a lot about safety and someone to attach to that you know you can depend on. Now, if you had a mother that possibly couldn't meet your needs as well, there may have been substance abuse in the household, or there may have been a lot of stress in the household. She met it sometimes, and other times she didn't quite meet your needs as well as you would want as a child. So then you have insecure attachment. A securely attached child, by the time they get into school, what they see is they're more focused, they're able to focus, they're able to attach in a good and positive way, they have better boundaries, their moods tend to be more stable. Insecurely attached children, and there are different forms of insecure attachment that John Bowlby came up with. One is anxious attachment. You're always looking around, you're always looking for other people and what they're doing. You need to know what's happening in the room. Well, of course, you can't focus as well on your work. That anxious or preoccupied attachment is very difficult. Ambivalent attachment, sometimes it's called. And if it's bad enough and severe enough, then you could get a label, which would be more as ADHD or ADD.
Depending on your age.
Depending on your age.
Yeah, so when you start little, the research tells us by age 2 or 3, you will have pretty severe behavioral dysregulations beyond the 2-year-old tantrums. It'll be pretty major. By those middle years, you'll be looking at things and they'll be diagnosing you with ADHD or ADD. And as you get 12 and up, they'll call bipolar disorder. Into those adult years, other more severe diagnoses that would demonstrate severe mental instabilities. But if we looked at the trauma piece, we'd recognize that really we don't have ADHD. We have untreated trauma. So the great thing is that as we treat the trauma, the symptoms that look like ADHD go down. And treatment for the trauma often in our world is just a pill. And a pill will not treat the trauma. I say treatment for the trauma. They're trying to treat ADHD or ADD or bipolar disorder, but because that's really not what we have, we just have those symptoms. Because the trauma's gone untreated, we give a pill. And the pill might make it worse, or it might mask those symptoms for a time period, but it doesn't heal the trauma.
That's true. And attachment, secure, insecure, and trauma tend to work together. So you're more securely attached when there's less negative consequences and negative experiences going on in the household and in the relationships within the family. And when you have more issues going on in the family, then it's harder to maintain a secure sense of attachment. So we have secure attachment, we have insecure as anxious or ambivalent. We also have avoidant attachment. And avoidant is this. And the child is, I don't trust you, I'm going to do it myself. And you can see that they probably have had some attachment trauma, relational trauma. So we have that. And then finally, 1 to 3% of children have disorganized attachment, and that is their moods tend to swing back and forth. A lot of depression, a lot of anxiety, but also a lot of anger and can be rage, and their life can be a roller coaster. And these people these children that have disorganized attachment tend to have a lot of diagnoses.
And also come from parents with disorganized attachment.
Absolutely. That's right.
It is generational.
It is generational.
Which could be discouraging, but also encouraging. Because when you consider that if we heal one generation, what we've done, we change it forever. You know, and to me, that's so encouraging. Because secure attachment is the foundation for good mental health.
Secure attachment is the foundation for good mental health.
So if we can create it in mom, then we've just done a gift for mom's children and their children and their children. Just like right now, lots of the balls are rolling down the wrong hills into disorganized attachment or anxious attachment, but we can turn it around and very quickly change a family system forever.
That's right. That is right. So, and that's why we're here, is for us to have some self-awareness and to see where we are in our own attachment, and also to look at the issues in our own home life, because we can change it. And it can be better not only for you, but for every person in your family. It'll impact your relationship with everybody. In regards to attachment, I want to talk also about something that's related to trauma and attachment, and that is something called the ACE test, which is Adverse Childhood Experiences. Adverse Childhood Experiences, by the age of 18, there are 10 different components to that test, and it was formulated by a man named Dr. Folletti. And Dr. Folletti started in the 1980s he was an internal medicine person, but he was the director of a weight loss clinic in San Diego. It was run by Kaiser Permanente, and it was a part of a large medical complex. But they specialized in morbid obesity, people who were 2, 3, even 400 pounds overweight. And Kaiser Permanente had, at least at that time, large complexes in a lot of the major cities in the United States. But he was in San Diego. He had seen something that was a reoccurring theme, and that's that a lot of these morbidly obese people were having great success with the program. They were losing weight. They were even getting close to their optimal weight, and they were leaving the program. They're just gone. So he didn't know what that was about. Many of them came back after several months, and they had gained all the weight back rapidly. More rapidly than he thought was possible. So he decided to make a questionnaire for these people that came back and asked them a few questions, trying to find out why this was occurring. He just didn't understand it. So one of the first people that he went through this interview with these questions that he had developed is usually called Susie, although that isn't her real name. But Susie had gone, and she had been morbidly obese. She was a small person in stature. She was in her 30s, and she had left for several months and come back and had gained all the weight back. And she had gotten down to her optimal weight, was in it and was trying to get involved in their stabilization program, just stabilizing her weight when she left, and they couldn't get a hold of her for several months. When she came back, he started to ask her the questions, and he actually tripped on his words a little bit. He wanted to ask her something else, but he tripped on his words, and he said, "How much did you weigh when you first became sexually active?" And she said 40 pounds. And then he realized he had asked it wrong, and he was sitting there going, He asked the same question, exactly the same again. How much did you weigh when you became sexually active? And she said 40 pounds. And she started to cry. And she said that her father had sexually abused her. Well, he had been a practitioner of medicine for 23 years, and this was only the second person that he had ever talked to as a patient who had been a victim of sexual abuse. And they talked for a while. What she said was her issue in that interview was that she started to gain weight again when someone at her work had noticed her new look and had shown interest in her. She was single and had never dated. What happened is she started to get up in the morning, and she said, I always clear off and make sure everything's clean on my counters in my kitchen, but there were bread bags that were left open, and she had mayonnaise jars with the lid off, and peanut butter jars with the lid off, and she said the utensils were still there on top of the cabinet when she woke up in the morning. She finally understood that she was sleep eating. She had no remembrance of it. She had gained all the weight back, and she had made the connection that it was because someone at work had shown interest in her. Well, as Dr. Folletti went on and started speaking to other patients and using the question that he had misquoted, exactly as he had with Susie, he started to see that about half of his morbidly obese patients had been sexually abused as children. He thought that he had made a mistake and that there was something about his way of conducting the interview that was leading. So he asked some of his other medical partners to go in and do the questionnaires with the people, and they were getting the same results. Well, that was really nothing short of amazing and outrageous, because the general belief, which had always been supported within the medical establishment and the medical community, is that childhood sexual abuse was exceedingly rare. And he was finding it, at least within this people group, to be much higher than anybody knew. And he ended up writing his first research article in 1993 about the correlation between obesity and childhood sexual abuse. Now, as time went on, this was only the first thing that he found. What he started to see is the people that were dealing with obesity also had been dealing with a lot of other childhood adverse experiences, and this became a 25-year period of research. And what came from that is what we call the ACE test, Adverse Childhood Experiences Test. It is the 10 most common experiences that causes issues later in adulthood. Now, these issues are disease. People with high ACE scores are more likely to have autoimmune disease, more likely to have cancer, more likely to have diabetes, more likely to be obese. COPD is higher. Also, substance abuse issues are higher for people with high ACE scores. And there is a relationship between a high ACE score, Adverse Childhood Experience score, and having problems with attachment. Probably a lot of attachment trauma early in life in relationship to these 10 different issues. So what I've decided we're going to do is we're going to take the ACE test as a group. These are 10 different questions. We'll go through them. Each one of them, if you give it a yes, that would be 1 point. And you're going to have an ACE score at the end between 0 and 10. So let's go ahead and start. Number 1, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? If the answer is yes, enter 1. Number 2, did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? If yes, enter 1. Number 3, did an adult or person at least 5 years older than you ever touch or fondle you or have touch your body in a sexual way, or try to have oral, anal, or vaginal sex with you? If so, that would be 1 point. Number 4, Did you often feel that no one in your family loved or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? If yes, enter 1. Number 5. Did you often feel that you did not have enough to eat, had to wear dirty clothes, or had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if it was needed? If yes, enter 1. Were your parents ever separated or divorced? If yes, 1. Number 7, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Or sometimes or often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or a knife? If yes, enter 1. Number 8. Did you ever live with anyone who was a problem drinker or alcoholic or who used street drugs? If yes, enter 1. Number 9. Was a household member depressed or mentally ill, or did a household member attempt suicide? If yes, enter 1. And finally, number 10, did a household member go to prison? If yes, enter 1. At that point, you should have your ACE score, which will be between 0 and 10. What they've seen in the research is 4 is a big number. If you have 4 or more points on your ACE score, your likelihood of having several different autoimmune disease, diabetes, obesity, these things all go up. Also, substance abuse. Also, behavioral addictions. They are the same as chemical addictions. So you're more likely to have problems with a gambling addiction. Smoking would go up. So 4 is a big number in general, and there is a lot of information about how this looks in adulthood and the research online in regards to the ACE study. Now, in Kaiser Permanente, they allowed him to use the different obesity clinics that were on several major campuses that were medical campuses throughout these different major cities in the United States. The thing about that is, this is not looking at people who would be on Medicaid. They were all insured because that's what Kaiser Permanente did. And most of these people were white. It's 64% of the original 17,337 people were white, college educated heavily. What they found in the original sampling that he did for his research, which was in 1997, that to have 1 ACE, that was 40% had 1 ACE, but to have 2 ACEs went up, and then to have 4 or more ACEs was 12.5%.
So that number would have significantly increased if you would have had maybe different demographics with more poverty or less two-parent homes. As you go to maybe an uninsured population, we would know it would go up.
That is the thought, and of course this has been recreated. I will say that the 4 or more ACEs seems to be, when you do a broad sampling, it seems to be pretty close in several samples that have been taken by other people. So that tells us that, but I think if you did a sampling of people that were of a certain region where you know that there's more trauma, you're going to see that go way up.
Or possibly a sampling of foster children.
Absolutely. Foster children tend to have a higher ACE score.
Or children from a war-torn area.
Yes, from a war-torn area. Certain areas of inner city would definitely show a higher ACE score. So, those are things to think about. Now, I'm going to go back to Susie. Susie, who was the person that had been sexually abused and lost the weight. She did lose the weight again. She is an excellent example of someone who had a high ACE score. She did not make it out of her 30s. And she got an autoimmune disease that was rather rare, related to her lungs. And it did take her life. She never smoked, and she never socially drank. So it was not about her lifestyle choices. And I think that's something to keep in mind. Many people with ACE scores do have more problems with autoimmune and diseases.
As well as psychological issues,
Anxiety.
educational issues. So it's going to impact every area of your life.
Every area of your life, and it's true. People who have higher ACE scores are less likely to follow through. They have more problems with work, maintaining a work job over a long period of time. They don't stay in school as long. They have more financial problems. They have more relational problems.
More difficulty raising their children.
Yes. But I have known people with high ACE scores who have made the turnaround.
I have too.
And their children do not have the ACE score or anything like it. And really, even my children don't have near as high ACE score as I do, because I tested them this last year. So it can change, and you can change that situation. I want to say, in conclusion, I want you to think about it and give that test also to your children and think about them in relationship to the ACE test. Things can change for them as well as it can for you. The most important thing that we've learned from attachment theory is to properly attach to our children. It's never too late, even if they're no longer an infant, to spend time really looking at them. Spend time, eye-to-eye contact is very important. It creates a lot of attachment for young children when they know that you are focusing on them. Let go of the electronics and spend time with them with catch a ball, go outside, and love them and tell them that you love them on a regular basis. It will make a difference in their lives. We'll come back and we'll definitely give you more tips on how to parent, but right now, that would be the one thing that has the greatest impact on attachment, is just to connect with your child. Is there anything, Dana, you want to say in closing?
Just thank you all for joining us. We're excited to have this forum so we can reach more families, because we believe with the right information and some work on your part that every family can heal. And if your family heals, that means that your child's able to heal too. So please join us over the next 9 weeks for the rest of this series.
All right, and remember, connect with your child. That's the most important thing you can do. Just sit down and look at them and connect with them, talk to them, and show them that you care. Until we get back with you, I'm glad that you connected with us this week. Thank you. Bye.